Hello. Hi, this is Christine. How is everyone doing today? I hope everyone's had a wonderful, wonderful holiday. Wonderful Christmas to all of you, and for those of you, a wonderful holiday season for you as well. And we're now coming to the new year. Wow, where has the time gone? It's just amazing how fast this time has gone. And I just want to just reach out to my team to see whether you can hear me fine. If you can message me, that would be great. And just so that I know that we are live. So good evening, everyone. I'm really, really excited that you're here today. And excellent, you can hear me great, wonderful. And I just want to really reach out to everybody about today, because today is about AI and the amazing things that's happening, whether we like it or not. It is here, and it is here to stay by the looks of it. And there's nothing we can do to stop this apart from embrace it and see what we can do to help us in our business, our healthcare business, so that we can be as effective and successful as possible as well. Because a lot of care providers, as we know, we are feeling, I've been in healthcare for 30 years now, okay? And I've had healthcare businesses for 20 years. And I've been a coach mentor now for 10 years. And I know myself, when I was running my healthcare businesses, having to do so many things, wearing so many hats as a care provider, there's got to be a better and easier way for us to run a multiple seven-figure business without exhausting ourselves. Because when you're running a seven-figure business, multiple seven-figure business, it's exhausting. And I'm being truthful and honest. And with AI now, we can start looking at that in a way that's going to increase and help our healthcare businesses that we're doing. And I just wanted to talk to you today about having a healthcare business and using the AI to boost what it is that you have in your healthcare business. Okay, so I hope you find this really helpful. And this is the first time ever that we are going to be doing a AI bootcamp in January. And this is for healthcare businesses, for professionals like you. Okay, so it's really important that we really understand this particular model. And I just want to reach out to everybody on that as well. So first of all, what I want to talk to you about is, for us to be really aware of where this has all come from. Now, you all remember, don't you? Well, not all of you do, because it depends how old you are. So where do I begin? Well, I remember when cassettes were out, and I'm going to show you a cassette. So just bear with me, because I think it's really important to show you how old I actually am. So just bear with me. I'm just going to leave my desk a minute. This is live. I'm not an AI robot or anything. This is me talking. So just bear with me a second. Okay, so I just left my desk because I wanted to show you. I'm in my office, okay? Now, does anyone remember this? Do you remember this? Does anyone hashtag cassette if you remember cassettes? Okay, now it used to be this. This is where it all started, cassettes. Obviously before that it was radio, for example, but cassettes, okay? Then it went to CDs, floppy disk. Do you remember floppy disk? You put it into your computer, you can save, you can back it up, And then we had CDs, okay, DVDs. Then it went from that to our, for example, our mobile phones, our iPhones, for example. Hashtag, if you remember, cassettes, CDs, DVDs, floppy disk. Hashtag if you remember that. Hashtag if you're a newbie, a gen. iPhones. So then we also had, with that was the computer, which we're using now. That is like a brain, isn't it? The computer. Okay, so hashtag anyone here that remembers that. Okay, so it's not new, it's just we're always evolving. Things are always going to be evolving. Things are always changing, just like water is fluid, and it's always, the ocean is always moving. It's always moving and changing. There's always different waves, there's always different flows coming through. Okay, and I don't know if you remember, years ago there was, for example, I don't know if you remember, there was Will Smith. 5 years ago he did it's on YouTube right now, he did a description, a video, he did a YouTube video where he was talking to a robot, Sophia. The robot was called Sophia. Does anyone remember that? Hashtag Will Smith. He was talking to Sophia, and Sophia was answering him. You know, the intelligence of these robots is really amazing. What can I say? Really amazing. But I wanted you to see how we've evolved into AI. It just hasn't just suddenly happened. This has been going on for, 30 odd years or more. You've even watched those movies, those sci-fi movies where they're doing the future and, quantum leaping and things like that. There's nothing new about this. It's happening, and we're part of that time. Okay? Hashtag if you've watched the Will Smith video on YouTube where it says Sophia and Will Smith is a robot, for example. Now, the difference here is with the robots or with AI is they don't have a soul. They don't have a soul like we do. We're human. We have a soul. We have connection. We have a heart. Our brains might not be as intellectual as an AI. However, an AI can't be human. It can't be a soul. They can create as much as they like, but there's no soul. That is unique to us. Okay, I just wanted to point that out to you. Hashtag soul. We have soul. And I don't just mean dancing. I mean, the heart, the soul that's within you. That is human. Soul is your selling key. Community is your key. The AI can't take that away from you. And I want you to think about this, because a lot of people are getting worried that, obviously jobs are changing. They are changing, so we've got to pivot and look at what we can do that's going to benefit us as a healthcare provider. And I tell you what, the soul is the key. The heart is the key. The passion that you have for healthcare is the key. It is not a numbers thing. It is not, human beings are not about automation in a fast way. It takes time for us to process things as well, so that we take time to digest about what's happening. So build your brand through soul. You can use pictures, you can use marketing, you can use video, you can use text, content to sell your services about what you're doing, but you're coming from the heart. You're authentic. You're loving and you're caring. Hashtag love, hashtag caring, so that we know that you are really thinking about how you can stand out. So dive into the world of AI. There are so many tools out there, automation, which you can uncover the secrets behind today's 8-figure healthcare empires. And I want you to be aware of this. And this is why I'm doing the live today, over today and tomorrow, and also at our bootcamp as well. But I want you to be aware about AI and to make that choice, to be informed, to make a choice as to you're going to embrace it. How are you going to embrace this within your healthcare business? Because it will help healthcare providers. Because when you're just starting out, you've got so many tools that you have to remember in your head to do on a daily basis. And why not use AI to incorporate those things, to take the load off of you, okay? So that you can still be even stronger in your healthcare business. So look at the healthcare industry. It's revolutionizing, okay? It is going to be a contributing factor in the success of today's multi-million-dollar healthcare empire. What you need to look at is coming from the heart. What is the need that your buyer wants in order to use your services? It's not about what you want, it's about what they want. It's about how you can fill that need. By going out talking to your community. The AI can't do that. Go out and talk to the community and speak and see what it is that they need and how you can help your community, and specialize in that. Because when you're coming from the heart, it's going to be a lot stronger than the AI, for example. Now, the future of healthcare. There's a journal which is called the Royal College of Physicians, right? It's called the Future Healthcare Journal. And it talks about the artificial intelligence, AI, in healthcare. So there's several types of AI that are already being employed. And care providers, as well as life sciences companies. So the key categories of application involve diagnosis and treatment, patient engagement, adherence, and administration activities. This is where AI is being employed. So, artificial intelligence, AI, and related technologies are increasingly prevalent in business and society as a whole. And it's beginning to be applied in healthcare in a really strong way. These technologies have also helped with many aspects as patient care, for example, administrative processes within providers, pharmaceutical organizations, and many more in healthcare. And this is why it's important for you to start thinking about this now, ready for 2024, in order to be ahead of the game. Okay? So there's going to be many years really before AI replaces humans for broad medical processes. So in the article, it describes both the potential that AI offers to automate aspects of care and some of the barriers to rapid implementation of AI in healthcare. They can't just suddenly put loads in straight away. They are, I mean, don't get me wrong, it is happening. I've seen it in hospitals, I've seen it in care homes, I've seen it in home care, with the big organizations. It has happened. However, it can't be rushed in where we've all got to implement it straight away. So you would have seen more recently about robots. They've become they're working in collaborations with us, with humans. So it seems strange me talking about in terms of humans and robots, for example, working together. It's a bit of a new kind of conversation, okay? So this is happening where people are being trained by moving them through the desired task. So they are becoming more intelligent as other AI capabilities are being embedded. So the AI, the tasks are being put into the AI's brain, for example, and over time it seems likely that that same intelligence that we've seen in other areas of AI will be incorporated into physical robots. And look at the Will Smith video. All of you, go to the Will Smith video after this live so that you can see what I'm talking about. So AI, it can improve medical diagnosis, it can speed up drug discovery, transforming patients' experience, managing healthcare data, and performing robotic surgery. And this is from the Physicians Journal that I mentioned to you. Okay, that I'm getting this information from, but I'm also seeing it myself as well. And so are some of my clients. So where does that stand for you as a healthcare provider? Well, you can start looking at AI, rota schedule software. Okay, so I'm going to talk to you about all these different things that's going to benefit healthcare businesses, i.e. you not having to have so many staff members that are costing, the labor costs quite a lot, for example, as a small business. So why not look at these aspects of things when you're starting out? for example. And then if you want to take more staff on, then yes, you know, by all means do so. But if you can have something that's going to help reduce your stress levels and workload, then why not do that as a provider, for example? Okay, it's not there. I'm not talking about replacing jobs. I'm talking about getting things in an order that's going to be manageable for you, and then you can have staff members then pour into the company as they should be, for example. So it's known for its friendly interface and integration with various business systems. Humanity. It offers powerful forecasting tools to predict staffing. So these are AI softwares that I'm talking about here. That is really popular, and I've seen it work within organizations as well. Just drink my tea. So think about what software that you can use that's going to really help you. You know, all you're doing is you're inputting the information of your staff members, for example, and clients, for example, and it's going to really do things really fast and quick for your organization. I remember there'd be times where, you know, you're spending, you know, a couple of hours minimum a day with the rota. With this, it's a lot quicker, because if someone goes off sick, boom, it's done it within seconds. Instead of you having to look and figure out who. So there is AI rota scheduling software that you can use, and it is good for small organizations like yourself. One of them is called deputy.com. Okay, this is a software, for example, that you can look at that's going to reflect healthcare. There's lots of different AI software that is about rostering, but you need to make sure it's healthcare, for example. And for the country where you are living, if you're living in America, then there will be a different one, for example. So which ones are you going to go for? We cover this in our bootcamp. So AI are being used in healthcare management to help the clinical notes for the care manager to create care plans and summaries and risk assessments. Can be done in a matter of seconds, in minutes, which will free up the care manager's time, or your time if you're the one that's actually doing the rotas and scheduling and invoicing and things like that. So it makes sense then to you as the care provider to look at what AI tools and softwares that you can use for your business. So AI Gen can automatically and immediately summarize vast amounts of data, which frees up your time for people to address the more complex needs within the healthcare system, the company that you have. Isn't that better? To free up people's time so that people can be more innovative, so that you can grow the company more without the restraints or bottlenecks within your organization. So AI is transforming healthcare operations, including optimizing scheduling or bed management. It plays a crucial role in improving the population's health by predicting the risk of hospitalization, administration, or assisting in the early detection of specific cancers. Therefore, it's enabling early intervention for better survival rates. Detect things earlier. So AI in various sectors, especially in healthcare, it does raise several ethical concerns that need to be carefully considered. And I'm going to go into that. One of them is data privacy. So AI systems require access to vast amounts of data, which can include sensitive personal information. So there is a risk of data breaches and unauthorized access to private health information, which can be exploited maliciously. It can be seen as bias and discrimination. AI systems can inherit bias presented in the training data, and this can lead to discrimination practice such as certain groups suboptimal care because the AI's decision making reflects historical biases. I'm just explaining some of the ethical and the unethical here. Consent. Patients may not fully understand how their data is being used by AI systems. This is raising issues about informed consent. Ensuring that the patient are fully informed about the use of AI in their care is a significant ethical concern. Transparency. So many AI systems are often seen as, it's in a box, for example, and because their decision-making processes are not transparent, the lack of transparency can be problematic in healthcare, where understanding the rationale behind the decisions is crucial for trust and accountability. So some of the software which you need to make sure that it is, going to be ethical and not be that, because there are some kinks in this AI that's happening at the moment, and they're ironing this out. But you have to be mindful of this and not think, let me just jump into anything. You've got to really do your research and review to make sure that it is safe to use. Because there's a lot of people out there that are saying, yes, I've created this AI software, and there's a lot of breaches when it comes to healthcare. Responsibility and accountability. When AI systems make decisions, it can be challenging to assign responsibility, especially if the decision leads to a negative outcome. So clarifying the legal and the ethical responsibility for AI decisions is essential. So there is also a concern that AI can lead to more impersonal healthcare system, where the focus shifts from patient-centered care to efficiency and automation. So we have to be careful of that. I've seen it myself when I was in the States, and there's a robot which is sitting there monitoring patients who are high needs. High level care is needed. And sometimes it isn't meeting their need. So we have to be careful of this to make sure it is meeting the needs of the person. So there has been the potential for AI to increase inequality in healthcare. If these technologies are only accessible to well-resourced institutions or individuals, further widening the gap in healthcare quality and access. autonomy. AI applications could potentially influence or even undermine patient and clinical autonomy by pushing towards certain clinical pathways or treatments. So the bias can come in here. Safety and reliability. AI must be rigorously tested and proven safe before deployment into healthcare setting, as failures can result in incorrect diagnosis, inappropriate treatment, recommendations, or harmful outcomes. Another one is job displacement. AI could displace certain healthcare jobs, leading to concerns about the future of the workforce and the potential loss of human expertise and in touch in healthcare. You know, it can touch healthcare. It's happening already in other industries. So I'm just making you aware of, this, that, people are losing their jobs as well. And I've seen it with the places in the States, for example, where they've had robots and things like that, which is replacing people's jobs, and there's staff members are reduced on the ward because they've got these robots in the rooms where patients' needs are high level. However, the robot can't get up and care for someone, for example. So, I just wanted to put that out there. Addressing these ethical issues requires multidisciplinary approach. That includes the technologists, healthcare providers, patients, ethicists, and policymakers to ensure that AI is developed and implemented in a manner that is ethical. It enhances the healthcare system without compromising human value. Is everyone hearing me okay about what I'm saying here? Because I really want to just make sure that we're listening and that you can get the feel of what I'm saying. Give me some hearts, give me some love, let me know that you can hear me okay. I just want to make sure that we are in the right place. Everyone hear me? Because I can't see you on here. So apologies for this. So I might have to go back. If my team can just let me know that you can see me on the page. Just want to make sure. Excellent. I can see myself. Am I live here? Let's have a look here. Excellent. I just wanted to check. Okay, so I'll continue on with this because it is important. Okay, so we need to look at the ethical issues. It requires a multidisciplinary approach, as I said. So we need to make sure that we are in tune and following what the guidelines are as a care provider, so that we can make sure that people are safe. So using AI in your care agency, it can host benefits, from improving your operational efficiency to enhancing patient care. And this is the reason why I'm saying this, because it's about improving your operational efficiency and also enhancing the patient's care, because then staff members will have the time for the patient and the service user. So it's got to benefit, and the staff will be more happy. That's the way I see this, as a positive way of looking at AI. Not as a job replacer, not as replacing humans, as enhancing the jobs that we're doing and providing the care and passion and the love that we intend to provide. And that will continue, and it will increase, that we will have more time to help vulnerable people, for example. Staff won't be so overworked. So with AI, there is a thing which they're able to do client matching. It is a AI algorithm that can match caregivers with the client based on the needs, skill, location, and even the personality traits to ensure compatibility and satisfaction. Because sometimes the client and the carer, they can clash, so they're not a match. And then you've got to send someone else in. So isn't it a nice way to have these things in place so that you can talk about your software that you've got, that you've gone that extra mile for the service user and for the patient, for example. Hashtag client matching. So using AI in a care agency can bring a host of benefits, from improving the operational efficiency to enhancing patient care. Isn't that really what it is that you're looking to do as a healthcare provider? So, as I said, the scheduling rota management, as mentioned earlier, AI-driven scheduling tools can automate the processes of creating your staff rotas, taking into account their availability, qualifications, and the working hours of the carer, as well as the needs and preferences of clients. AI can indeed be used to predict the likelihood of staff absenteeism, including potential sick leave. Isn't that a good thing to have that? By the way, I've created a software which talks about staff absenteeism prediction. So it can also do the historical data analysis. So AI can analyze past attendance records to find patients related to frequent absenteeism. It can also do employee engagement. So the AI tool can gauge employee engagement through interaction with the workplace software. So lower engagement levels may correlate with higher absenteeism. So the AI can benefit your organization in that way. And I'm referring to it using it as a tool to benefit your organization, to enhance what you've currently got, and to help the staff members so they're not overworked and burnt out, for example. So health trends. AI can monitor public health data and predict potential increase in illnesses that might affect staff, especially in the case of seasonal or contagious diseases as well. Stress and burnout detection. AI systems can detect signs of stress or burnout by analyzing factors such as work hours, productivity levels, and even social media sentiments, if integrated, which can lead to sickness, absence, for example. So think of that. Looking at all the different things that you can have implemented predictive analysis. So based on factors like workload, personal employer data, historical sickness records, AI can forecast the likelihood of future absences. So the analysis, the AI can analyze communication patterns for settlement, which can be an indirect indicator of employee physical and mental health state, because you want to help your employees. However, this could be a privacy concern. Predicting sickness and absenteeism involves handling sensitive data, which must be managed in compliance with privacy laws and regulations like GDPR, HIPAA, for example, or other, depending on the region that you are. So there's ethical considerations. So the use of AI to predict employee sickness can raise ethical issues, particularly if it leads to negative consequences for employees who are flagged by the system. I'm just making you aware of the good, the bad and the ugly, basically, of AI. Human element. So AI predictions should be used to support, not replace, human management decision. It's essential to maintain a supportive work environment and address the root causes of absenteeism, such as workplace culture, job satisfaction, mental health support. It's not a replacement. Remote monitoring. AI-powered devices and apps can monitor clients' health parameters in real time, alerting carers to potential issues before they actually become emergencies. Customized care plans. AI systems can analyze historical health data to help create a personalized care plan that adapt over time as the need of the clients change. There's a lot of benefits here for care providers. It can do administrative tasks. So AI can automate many administrative tasks such as billing, compliance, reporting, maintaining client records, freeing up staff to focus on the care provision itself, taking away the administrative burden that we are placed. So, enhanced communication. AI chatbots can provide quick answers to common questions from clients and families, improving the communication and freeing up your time with your staff. There's AI that will even answer the phone for you. Training and support. AI-driven training platforms can offer personalized learning experience, helping the carers to improve their skills and knowledge in line with the latest care practices. So it can do even training for your staff members. It will help you as well to stay compliant, keep abreast of any regulatory changes regarding the use of AI in healthcare to ensure compliance. And I really want you to think about how it can benefit you in your healthcare organization. So if you're AI based, you can actually do check-in calls, welfare checks, without delivering personal care or medical advice. Then it does not fall into the category of regulated activity. It's always good though to talk with the Care Quality Commission. However, if the calls include any form of personal care or medical assessment or advice, then it's likely that you will need to be registered. So look at what it is that you're looking to do, and then speak with the Care Quality Commission or the organizations that regulate you within your region. Now, I hope that you found that useful. If you're watching the replay, hashtag replay. If you're watching the live, hashtag live. Let me know that you've heard and you're learning a lot today, because tomorrow we have got so much to show you as well. Within the 40-50 minute live training tomorrow, I'll be going into more depth as well about what I've spoken about today. But I want you to also be aware that we have got our bootcamp, which is our first AI bootcamp, the first of its kind in healthcare businesses. And I want you to be aware of the tools that are being used currently right now that is going to really skyrocket your healthcare business for 2024. The bootcamp is not like any other bootcamp that I've done before. This is a completely new bootcamp which is talking about AI tools that can be used in your healthcare business and what it can be used for and how you can implement it as well. And I hope that you'll be able to join us in January for our 3-day bootcamp, because you don't want to miss out on this. Now, I want you to register your interest for our bootcamp, our AI bootcamp that you are able to join. The price for the AI bootcamp is it's only $397, and it is going to it's 2 days. The AI bootcamp is 2 days, and I hope that you'll be able to join us. It is $397, like I said. A member of our team will put into the chat if you want to register your interest so that we can talk to you one-to-one over the telephone or via Zoom, for example, about the 2-day AI bootcamp, because it is for healthcare professional businesses like you. You want to know what the 8-figure businesses are doing? Then you need to be at this bootcamp. But join me tomorrow, because I'm going to talk to you about those tools that are in the bootcamp as well, and why you need to use this and how it's going to really enhance you, because it's like you've got a team of people working within your healthcare business. Like I said, this isn't about replacing jobs, it's about making it efficient for you and affordable for you as well. So do register your interest. Don't miss out on day 2, where we talk about the software as well. And I hope that you can join me for the live tomorrow. I hope that you found this really informative. I can see the link is there. There's a form there where you can register your interest, and you can also register and book a free discovery call regarding the bootcamp, the 2-day bootcamp, which is in January. And I hope that you'll be able to join us tomorrow. Tomorrow will be at 7 p.m. the same time as today. For example, I hope that you watching this replay, you're watching this live. If you're watching the live, just hashtag live so I know. If you're watching the replay, hashtag replay. Let me know that you're interested in the 2-day bootcamp that we've got in January. This is an AI business bootcamp. I don't want you to miss out on this, because it is not like any other bootcamp that I've run before. This is completely new, and this is where we need to move forward with, because AI is here. We can't stop it. It's here. It's with us. What we can do is control how we're going to use it within our healthcare business. but it is already out there with the big organizations already using it. Some of you may be seeing this already. So if this is something that you'd like to do, you're interested in finding out more, then do book a call with us, as well as register your interest. The form is in the chat. And what I want to talk to you about is really going through with you our 2-day boot camp, which is in January. So I hope that you can join us in our boot camp. If you are interested in joining our boot camp in January, hashtag bootcamp January. So thank you. I hope that you've enjoyed today's training, because like I said, AI Business Bootcamp is what it's all about. And I want to be able to show you the new things that people are using now. 2024 is here. There's no avoiding it. It's here. We need to embrace this AI that is upon us all. Okay, so I hope you've had a wonderful evening. Hope you've enjoyed this training today. And I want to say thank you for taking the time to listen to what I have to say, as well as the learning and opening your mind up to AI. So thank you so much, everyone. I will see you tomorrow. Take care. God bless. Goodbye. Take care. Bye.